So hey everybody, I'm Kate Ryder, I'm the founder and CEO of Maven, and it's genuinely really fun for me to be back here in London. So fun fact, Maven was started here in London nearly 10 years ago, and back when Maven was 3 people, we worked between my kitchen table in my flat off Edgware Road and White Bear Yard. I don't know if anyone works here at White Bear Yard today. I raised our early capital in Mayfair with the VCs who had offices there, and I met our first engineer actually at a hackathon in Shoreditch, back when I guess Shoreditch was cool. I'm hearing it's not anymore. But anyways, I also came to these conferences, and I was kind of the anxious entrepreneur sitting in the audience who cared so deeply about women's and family health. It wasn't really talked about as much, and I was definitely wondering, would Maven ever get off the ground? And it's really wonderful to not only be back here, but also to see so many friends from that time. Jack Krenler was here earlier. I don't know if he's still here. Emily Four, because really so many of those conversations and that support in London in the early days, really spearheaded Maven's product and were so instrumental to our growth. So I'm excited to talk about the last 10 years, but also the next 10 years, and specifically how London and the UK really factor into our growth story now. So first, let's go back to London, circa 2019, no, I wish, 2014, be much younger. And that was when Maven came about. So I was covering digital health at a venture capital firm, Index Ventures, and I was an associate there. And a lot of my friends were starting to have kids, and I knew I have now 3 kids, and I knew I was about to enter that decade, so I was very, very interested in the topic. And so as I was meeting a lot of digital health companies at that time, there was a few things that really stood out. Number one, the one thing everyone was really trying to crack was patient engagement. But patient engagement is really what's needed for clinical outcomes. But a lot of the consumers of these companies at the time were female, and no one was really focused on the female consumer or her health. And you could see it in all the engagement data. So as a former journalist, I like to always report out some of the stories. And so I gathered a lot of friends of friends from a lot of different nationalities in 2013 and 2014 in a series of focus groups. So these were friends from mostly British, but also America, French, British, Spanish, Indian, Israeli, German, Swedish. So we were talking a lot about those national health systems all together in one room. And what was really clear was that no matter what healthcare system you were from, there were gaps everywhere. I think it's been amazing to see here today that a lot of what we're talking about are these gaps in women's health. We just weren't at the time. I mean, these were really just confined to conversations among friends. And so, really in one word, what everybody was talking about was access. So everyone was talking about, even if you had lived in a public health system or you had a public-private, you still lacked access to specialists, or you still lacked access to, the right care at the right time, or access to specialists that might have spoken your language, or, shared your lived experience. And core women's health issues like maternal health and infertility care, miscarriage, postpartum support, these were just not in many of the care models. And so what was just so clear is that the universality of the problem was just not, was not confined to one place or one specific geography. And so, equipped with so many of these user stories, and here's some of the quotes that we were talking about. And what's amazing is that some of these women are coming together for dinner tonight, and I've asked them to please come armed with their stories of how things have changed and whether things have gotten better. But what's really clear is that, equipped with so many of these user stories, I took a step back and I looked at the data. And so again, we've been talking about some of this today and some of the other presentations, but the data tells a pretty bleak story. So, starting with infertility, 1 out of 8 couples globally suffer from infertility, and here in the UK, 1 out of 7. Yet fertility care often did not kind of fall outside or fall inside core reimbursement models. So a lot of people just couldn't pay for the care. Maternal health, central elements of the care model were not included. And so, a lot of what we talk about and see is mental health as being one of the big areas that really needs to come, into the core care model. 1 out of 5 women suffer from postpartum depression. talking a lot about menopause today. I've recently, we launched a product in menopause, really inspired by so much of the thought leadership here in the UK. And I've become a student of that. And I've been shocked to learn things like 4 out of 5 women who go to their doctor to talk about menopause symptoms leave kind of untreated and don't get the care that they need. And so, I think for us, really this all adds up to one of the biggest opportunities in all of healthcare, which is that this group, women, families are the main caregivers of families, they really drive all the decisions in healthcare. And so they typically look after care not just for themselves, but also their families. And so if you can work with this core customer during one of the most vulnerable and sensitive times of their life, the value of that relationship multiplies year after year. And so you can see major ROI, not just in these core areas, but you can see it cascade across the entire healthcare system. So, it took a long time to land a lot of these messages, and particularly in those early years after moving from London to New York, fundraising was brutal. The message finally, though, is landing. And I think COVID was a big part of that. COVID really accelerated the adoption of digital health. We're talking about the maternal mortality crisis globally. We're talking about parental burnout. We're talking about childcare affordability. And we're talking about health equity. And this is at the center of so many global dialogues. And so, really, really proud to say that today we're the largest virtual clinic in women's and family health. We have members in more than 175 countries. We serve more than 450 employer clients. We cover 15 million lives globally. And since our first days here in London, we've stayed committed here to the UK and Europe more broadly. And so the UK is now our largest market outside of the US, with about 70 employers here and rapidly expanding. And I honestly believe, we're in the very early innings and just scratching the surface. So let me tell you a little bit about what some of the data has shown us over the last 10 years and some of the impact we're seeing in the market. So I like to describe Maven as a true technology company and a healthcare company in equal parts. So our largest teams sit between our engineering teams and our clinical teams, and all of our impact starts with product. So from those early conversations in London, we haven't really wavered from 2 core principles. Number 1, Maven is end-to-end. So what that means is we span preconception care, fertility, pregnancy, parenting, menopause. And so you can have that continuity of care no matter what your path. And so, I was asking some of our care advocates here in the UK for some of our stories that illustrate that. And so, for instance, right now, we're currently supporting a woman in London who enrolled in our fertility track, experienced a pregnancy loss about 8 weeks into the pregnancy. She's back in our fertility track, and now we're helping her with cross-border egg donation between Spain and the UK. So that just kind of shows you these are not linear pathways, but they can be really, really circular and circuitous and full, of course, of lots of anxiety. Second, Maven's an all-in-one product. And so, really we look at the 3 pillars, clinical, financial, and emotional support, as really where we have to go deep across all of our products. And so beyond our virtual care, which I've talked a lot about, we also have Maven Wallet, which is our payments platform. And so another patient story here in the UK right now is we're supporting a single dad who is going through adoption. And not only are we kind of, his employer has launched the adoption benefit, and so we're supporting and processing all of the payments he has around that, but he's also working with a counselor on Maven who is LGBTQ to talk about, being a single gay dad and what that's going to be like on his parenting journey. So, when we read through our member stories, really, even those 2, what stands out is that it's our care advocates and our providers who are truly the heart and soul of Maven. And so, healthcare is decidedly local, but there are gaps no matter what you do with local healthcare. And so, we believe that one of the ways to really leverage technology is to fill gaps with telemedicine that specializes in culturally competent care. So what that means is you can request providers of a certain race, of a certain gender or sexual orientation. You can select providers in certain countries or who speak certain languages. And there's over 30 specialties in our network. And so this means that all of these different providers, and you can see on this graph, support women's and family health in all the different phases. And so, you can see women's health and pediatrics are connected in our postpartum period. We have a lot of pediatricians that are used. In menopause, you see a lot of career coaches, so we connect that back to the workplace. And really this holistic care model ultimately builds trust with members because they're getting access to providers on Maven typically within an hour, and they're providers that they trust and they can get access nowhere else. And so this, in a nutshell, this human care and this human touch of support is key to our clinical outcomes and our retention and our engagement. And so, what difference does this approach make? Really, it makes a lot. So here you can see that the culturally competent care model that we have is, we believe, one of the big unlocks to improving health equity. And so in both the US and the UK, I know this has been mentioned earlier, there are major racial disparities in care. So in the UK, the maternal mortality crisis disproportionately affects Black women, who die 4 times the rate of white women in childbirth. And in the US, we have similarly bleak statistics. And a lot of studies show that if Black patients meet with Black providers, they have better outcomes. And so with 32% of our providers identifying as BIPOC, some of whom are Black, one of the key pieces of data that we presented last year at the American Academy of Obstetrics and Gynecology conference is that Black members utilize Maven's virtual services at higher rates. Around 50% of our Black members who visit with a provider on Maven see a doula, which is around 2x the rate of our white members. And doula usage is also associated with better outcomes. So, I know advancing health equity is hugely important here and around the world, and we're so excited about the promise that digital health is showing here. So zooming out, really we bring about our clinical outcomes through putting patients in the driver's seat of healthcare. So over the last few years, we've published in a lot of peer-reviewed journals. We've gone through objective claims analyses to really see, can a virtual model really affect outcomes? So there's rarely a silver bullet, as I'm sure you know. And so really what we're seeing is the magic comes together when we put all the pieces together. So we've seen a 4.2x reduction in ER visits for all Maven patients who have met with a virtual OBGYN. We've seen a 27% reduction in C-section rates for patients who go through our maternity care programs. And we've supported over 30% of maternity patients with mental health support, whereas the typical rate at which someone is seen by a mental health provider when they're pregnant is about 5%. So when patients have options, we think this is really where everybody wins. And so today we're really thrilled to announce building for the patient comes full circle as we announce our acquisition of Natal. So I was immediately impressed when I met Layla, who's in the audience a few months ago. She's a passionate, I can't see you, but she's a passionate entrepreneur. Oh, there you are. She's a passionate entrepreneur and mother who shares Maven's commitment to expanding access to care for women and families. And Natal, also similar to Maven, took the approach of building out a deep network of providers just following patient needs. The incredible trust with members is really evident in all the patient stories. My favorite is about Ruth from Doncaster, who had been suffering from perinatal depression. She was going through her 2nd pregnancy. She could not find anybody locally. The wait time at the NHS was 6 months, and so a friend told her about Natal. She started talking with a provider within 24 hours and talked to them until the birth of her daughter a few months later. And so, with 40% of women in the UK not having access to a dedicated perinatal mental health provider, Natal's been filling a huge gap in care, and without Natal, Ruth had nowhere to go. So, in my conversations with Layla in recent weeks, we've talked about the ways in which a holistic virtual first care model can be really supportive of patients here in the UK and throughout Europe as we continue to build out our services here. So first, one of the things that we've really talked about is, and again, we've heard it today, is there isn't enough training or awareness amongst GPs about women's health. Services are often really fragmented and vary geographically, and patients are often subject to long wait times like Ruth. So where we believe that Maven can make the most difference is in expanding access to specialists and continuing to offer holistic care that meets women's entire reproductive health needs. We're also really really encouraged by a lot of the commitments in the recent women's health strategy by the government to invest in disciplines like fertility and gynecology. Menopause obviously is another really fast growing area, and in a response to call, just to illustrate what a gap there is, in a response to call for evidence for the women's health strategy, only 9% of the more than 100,000 respondents said they felt they had enough information about menopause. So together with Natal, we're really excited about the broader impact we're going to have here in the UK and throughout Europe. And so to close, I just wanted to bring us back to our patient, because I think everyone here in one way or another is really focused on tapping the power of technology to reform healthcare, to create a better and more personalized experience for patients, and ultimately just help people live healthier lives. I think one of the, my very biased opinion, one of the most powerful levers we have is to ensure that our collective global system really centers women and really centers families and fills the many gaps in care we see all around us. So this is where we've been the last 10 years. This is where we're going, is building for patients, and it's the formula we'll continue to follow. So thank you so much.